are the chances of South Africa dodging the fourth COVID-19 wave? Well, let's find out from Professor Adrian Puren in just a minute. The country, in the meantime, recording 592 new cases in the last 24 hours. Sadly, 83 more deaths were recorded. That's about a 2.1% positivity rate. Professor Puren joining us now. Of course, he's currently the acting executive director of the National Institute of Communicable Disease. Prof, good afternoon. Thank you very much for your time. The numbers are low, although KwaZulu-Natal, I understand, is still ahead, or has got most of those 592 new cases in the last 24 hours. And we're still having people dying. These low numbers, are they indicating really now that we are out of that third wave at this stage?
Yes, thanks very much, Dan. Yes, so in fact, the whole country now is out of the third wave, if you look at all the data. And in fact, that was, I think, yesterday, in fact, when both, as you know, the Northern Cape and the Free State were certainly still trundling along in terms of the not exiting the third wave, but they certainly have. So the numbers are low. You're going to see variability. So I think it's not a matter of saying that KwaZulu-Natal has more cases than X or Y. I think it's just really keeping an eye that those numbers are low and that they are kept low, if not lower, as best as possible. But obviously there's ongoing transmission that we need to just now be cautious about in terms of will there be any infections. And as you said, you know, we'll be heading to additional resurgences in terms of, you know, community outbreaks, spikes, and so on that we need to be concerned about as we have lifted so many of those restrictions and greater mobility. You know, what does that mean in terms of the numbers that are allowed to congregate, both inside and outside? What are the implications, and try to keep those numbers low?
Yeah, there was some criticism. There was some criticism after the president announced a few weeks ago that outdoors we can have 2,000 people. And for the first time in many months, we saw football fans at the FNB Stadium last night urging Bafana on to beat Ethiopia 1-0 in the World Cup qualifier. About 2,000 of them. And of course, they had to show and prove that they are fully vaccinated. There was some criticism, though, because we're also in an electioneering mode at the moment. Could those kind of relaxations increase the chances or the risks of a fourth wave?
As long as there are controls in place, I think that's going to be really critical, is that if we're saying that outdoor events, obviously, certainly the chances are far less versus, for example, closed indoor events. But it's really managing those particular events and trying to minimize risks as best as possible. I think if there are no controls present, then I think that way we may well see problems. Because again, you just need super spreader events. You know, it's not all people that will transmit, but you just need a small group of people to start spreading, leading to, you know, particular outbreaks and spikes and so forth. That's the important consideration. But I think really critically now is really to try and get the vaccine or vaccinations up as best as possible, because I think it will definitely contribute to trying to really look at a different resurgence, if you like. I know we just speak very often of a so-called fourth wave, but maybe we'll change our ideas around epidemic control in terms of can we live with this particular virus, and what would it look like if we are able to achieve high levels of vaccination as we've seen in other countries.
Currently, I'm not aware, unless I've missed it, in terms of interviews and reading some other reports, of a new variant. Delta variant is still very much the dominant one in the country, because that can complicate matters. With Delta remaining the predominant variant currently of infection of these low cases in South Africa, can South Africa dodge the next resurgence, the fourth wave? Can we dodge it?
Yes, I think, you know, our idea about the so-called fourth wave, I think we just need to say, well, what will that really look like? So, yes, provided that the Delta variant continues to be in circulation, provided that we have high degrees of vaccination, and in specific age categories, I think we can really then ameliorate and mitigate against that. But it's also important to realize that with these low numbers, it still means that our hospitals need to be prepared and ready in terms of bed capacity, oxygen supply, staffing. So those are, at this particular moment, I think it's really important at this particular ebb, if you like, that we are still ready, though. But hopefully with our vaccine campaign, we can really try and mitigate as best as possible in terms of trying to prevent hospitalizations. It's really interesting to see data from other countries. When you look at who's being hospitalized, it's really those people who are not being vaccinated. The smaller proportion of people are those that are unvaccinated. And now, of course, that will change as more and more people get vaccinated. But certainly the level of severe disease and hospitalization should certainly decline.
So the message from you, Prof, as we conclude is that get vaccinated, please, if you haven't got vaccinated. Number two, if you're hosting any event, respect the existing level, the relaxed level 1 lockdown restrictions. And number three, continue to follow those non-pharmaceutical interventions of social distancing and wearing of masks. That has not changed.
Absolutely. Those are the key points you raised. Let's emphasize them. Thank you.
Thank you very much. Prof. Adrian Puren, they're telling us, of course, he's the acting executive director of the National Institute of Communicable Diseases, just telling us, just keep on doing your bit, but please do get vaccinated. Now,